Welcome to Knowledgeable Aging. I'm your host, Jason Kotar. Joining us today to talk about orthopedic care for the aging population in the post-COVID era is Dr. Alejandro Badia. Dr. Badia is a hand and upper extremity surgeon, author, and healthcare entrepreneur in Doral, Miami, Florida. In 2008, he created the Badia Hand to Shoulder Center, and in 2010, he launched OrthoNow, the first immediate orthopedic care center in South Florida. Dr. Badia has outlined his journey and delved into the major challenges and hurdles of delivering healthcare in the U.S. through his Amazon best-selling book, Healthcare from the Trenches, published during the COVID-19 pandemic. The presented content does not provide or constitute medical, financial, or legal advice. The content is for information purposes only. Viewing or listening to the content does not constitute a physician-patient, dentist-patient, fiduciary-client, or attorney-client relationship. How are you doing today, Dr. Badia?
Great. How are you? Just finished with patients, so all good.
Yes, I know. Busy. So I'm going to go ahead and turn it over to you, Dr. Badia. Orthopedic care for the aging population in the post-COVID-19 era.
I'm going to just give my disclaimer here. Obviously, these are my thoughts and views, and this is gathered over basically a quarter century of doing orthopedic upper limb surgery. So, in terms of background, you mentioned I did my undergraduate work up at Cornell and then stayed in Manhattan where I went to medical school and then trained. Went later to Pittsburgh and then to Germany to do further training. I founded the Miami Hand Center, which at that time became 5 hand surgeons, and then I've been in my own center for the past 12 years. And as you mentioned, during the pandemic, I basically put this book together that describes what some of the challenges are. And I think during the pandemic, I think we saw some of those problems exposed, but I like to be an optimist. And I do think that this pandemic is sort of a reset, like in many industries. And I think that there's some very, very good positives that we can see coming out for healthcare. And I'll be mentioning some of those. And, for me, somewhere along the way, I realized I was an entrepreneur, kind of reluctantly, but I see there is a lot of problems in healthcare, and I'm hoping that we can navigate them together. And really, the discussion is needed because we are twice as expensive as the next country in terms of healthcare costs in the U.S., and that's not going to get any better as our audience is aging like all of us, and the percentage of older people in our society is going to go up as we get healthier, which is a great thing, but that leads potentially to increased costs. So we really have to change how we deliver healthcare, not just talk about who's insured or not insured, and that's the dialogue you currently hear in the political world, and that really isn't solving the problem. I think we could all agree. So in terms of statistics, the current number of adults over 65 is going to double, and I'll be joining this group very shortly, and it will double by 2050. So we're talking almost 100 million people, and many of us are going to continue to work. I know that's going to be the case for me. So that is, really active people, and in active people there are orthopedic issues, whether it be injury or it can be simply degenerative problems that occur. But we have many more solutions for it nowadays, but those solutions cost money. So we either ignore the treatments, or we have to sink money into things that we do now that do help us. But we have to kind of be smart about how we do that. So, currently the most common cause for injury, orthopedic injury, are falls. So that means that we need to worry about a balance control. There are great programs now for minimizing falls in older patients. So that's the most common cause for these fractures, as opposed to in younger people where it tends to be motor vehicle accidents. And unfortunately, we've seen with some of the violence that's occurred around the country is penetrating injuries, meaning gunshot wounds. So that in the younger people, it's a very different spectrum of injury. And this so-called fragility fractures are really due to bone density. Inevitably, we lose bone as we age. Women see a huge acceleration during the menopausal years, but there is technology and pharmacology now that can slow that down. So it's very important that the patients are assessed by their primary care doctors whether they are candidates for medications to minimize the effects of osteoporosis. Interestingly enough, the hospital length of stay is really not very different for different ages. So certainly our older patients are healthier nowadays. We are in this sort of perfect storm of healthcare, I believe. All the things that you read there are true. It is very expensive. We know it's inefficient. Things we never talk about, it's extremely unpleasant and unfriendly lately to seek healthcare. It shouldn't be that way. I'm not saying it has to be, luxury hotel, but certainly when we are in pain or we have a problem, we really want to be treated well. And I think that has a good bearing on outcome as well. And that's been proven. So there's no question that we need to put a little more customer service back into healthcare. And certainly in my own practice and even in Ortho Now, which we'll talk about, it's almost required reading to books on customer service. And all of these things have been worsened with the current pandemic, which I think now we're starting to see a light at the end of the tunnel. But there's no question that we have to do something. We cannot ignore it. So this is kind of a humorous cartoon, although for most of us in healthcare, we kind of see it as a nightmare because we know it's expensive. We know there's problems, but currently the big stakeholders are the insurance industry, which we know does not provide healthcare. They talk sometimes like they do. Their goal is to collect premiums and pay out for healthcare, and that's great. They deserve to make a lot of money in the process, but we've kind of lost sight about the fact that they're not delivering healthcare, and even the pharmaceutical companies are a very critical role, right? We've seen how they've stepped up when we cut back some of the regulation, and thank goodness they've developed these vaccines. So my hat's off to the industry, but we've got to make sure we keep those costs really in check. In terms of injury, which we mentioned, this could include whether it be falls in the elderly or motor vehicle or industrial accidents, right? Workers' comp. That can account for almost $750 billion because it's not just the medical care, but it's the cost to society. So say an injured worker is off work for months to recover, that employer has to retrain a person and the productivity goes down. So there is a downstream effect of injury that is very important to society. And I don't think that our politicians are discussing this enough. So we need to be very cognizant. And I already mentioned in terms of what overall healthcare costs are approaching $4 trillion. In terms of percentage of GDP, that's twice as expensive as the next country on the list. And you can see that here on the right. Currently now it's nearing 20%, but it's going to go up over 20% in the next 6-7 years. And the percentage of healthcare spending has increased much faster than everything else, including our wages, which I think is pretty important. That's gone up 16% in terms of real dollars, and yet healthcare costs have gone up 800%. So this is not something to take lightly. Little humorous here is, again, the waiting, the inefficiency. These are things that all end up costing money. When something is inefficient, it costs more money. So one of the things that my book does is points out the problems. That's really the goal. But everyone always wants to know solutions. So even though I spend most of the book talking about what the challenges are, I decided to summarize seven potential solutions that are in the last chapter mostly. And it's not just myself. There are 27 contributors to my book, including a few patients, because I think it was important that the patients are in the trenches as well, not just the providers. We hate that word, but I'm meaning the physicians, the nurses, the technicians, the therapists. All of those people are the ones who provide the healthcare. And what's important is that all of us have to be involved in this dialogue. If we are really going to decrease the costs as we go forward and try to flatten that curve a little bit, whether it be the politicians, the insurance industry, municipalities, all of them have to be speaking to us because we're actually delivering the care. The other thing is we have to minimize all these barriers, which are the middlemen, meaning you go to your physician, they order a test, and now all of a sudden there has to be an authorization. That all that does is delay care and drive up the cost. Now, kind of a radical idea, and I talk about this in the last chapter. I won't tell you what country, but I give a good example. of one country that's figured out how to have health insurance still private, but make it nonprofit, meaning that if they do well, they compete on the market. But then the people who work there can be paid better, but they need to dump the profits back into delivering care, because otherwise we're answering to Wall Street, and I don't think our health should be answering to investors, quite frankly. Also make it more efficient by having more outpatient centers. So we're seeing that now with the pandemic. The other day, a 99-year-old woman was brought in by her son, her nephew, who's a physician. And he knew well enough, he says, I'm not bringing my 99-year-old aunt to the hospital where she's definitely going to be exposed to COVID, which really could be a death sentence. And she had an elbow dislocation. The elbow was completely out of joint. And she came to Ortho Now. We gave her light sedation in our outpatient surgery center, which is down the hall. And I was able to reduce and pop her elbow back in. She was here for no more than an hour and a half, much less cost, much more efficient. Transparency. We need to know what our healthcare costs. That's one thing. The last administration, before the president departed, that was one of his initiatives, is to really bring transparency to healthcare, because otherwise, how can we compete? One of the things also is that us physicians aren't great at collaborating. So this is a call to any of the physicians, maybe retired doctors out there. We really need to do something to cooperate, because otherwise the other forces in healthcare are going to continue to have control. And then educating the public, and thank you, Jason, for this opportunity, because if these ideas can't be conveyed to the public, everyone listening, then how can we possibly solve the problem? And we've already mentioned that it's really one of the least efficient healthcare systems. You see here, the amount of time just patients spend on paperwork or dealing with medical bills. And it's quite bad in Switzerland. In fact, in my book, one of the contributors is a Swiss orthopedic surgeon, and it's the same exact problems we have. So you can see in certain countries there isn't an issue with that. Here, the UK, it's a nationalized health system, right? So it's only 2%, but they have their problems too. And I'm not sure Americans would stand for a system that's like Canada or the UK, where you have to wait long periods to get care. So I think that we have to find a balance. And because of the cost and the hassle to get care, you can see here in the US, if patients are below average income, that can include retired people, right, who don't have their income level, they end up not getting recommended tests or treatment because of costs. And if they don't, there is a downstream effect, because many of those things end up becoming a bigger problem, ultimately a more expensive problem. So here is I mentioned in my book, I have a subsection that says that authorization is really a 4-letter word. It's because it really makes us curse when you're seeing a patient. Like today, I'm in my office, and it seems like almost every step of the way we have to have this sort of number. And I'm thinking, well, why do we have that? Once you've been seen by the right type of clinician, let us order the things that we need, or procedures that we need to do to deliver the care without all these barriers, because these barriers end up delaying the process. You can see it here. I mean, just a primary care doctor orders a series of lab work. I mean, it's a whole process to get all the way to here. Okay. So the bureaucracy is costing us money. It's really strangling how we deliver healthcare. Here's the most interesting man in the world who might be listening in as an older person, and I think I've joined that ranks now, where this is my impersonation of him. And the idea of this slide is to point out how ridiculous the bureaucracy is, where there are codes which a few years ago were increased from about 30,000 from 18,000 to 130,000. These are called CPT codes. And there's actually a code that if you're bitten by an alligator versus a different code if you're bitten by a crocodile. So that just shows that we're spending inordinate amounts of time sitting around a table, by bureaucrats. There is no reason to have this depth of detail just for a diagnosis. Okay. And part of their problem is just that there's so many more administrators now than physicians. Now we need administrators, and I can tell you, in some of the hospitals, I have great friends who ran hospitals, and And the ones who were efficient really did very well. But as you have more and more people getting involved in delivering healthcare, it ends up oftentimes making it less efficient and certainly more costly, because these people command a salary and benefits as they deserve. So, this chart's very daunting, because we're increasing physicians like this, but administrators like this. Okay, and not to mention the salaries. That's kind of upsetting to doctors. I mean, if you look at real time, most of us actually make less money than we did a decade ago, and that is not the case for the administrators. Now, so here's an example of just health insurance. I mean, I don't have to tell you that there's not a single, cardiothoracic or neurosurgeon who makes, even a fraction of some of the top earners here. And I'm not sure that's right. And again, I'm a capitalist. I fled Cuba, so I am, I'm not at all a socialist, but there has to be, some limits. And I think if anybody agrees that maybe, certain athletes shouldn't be making, 40 million a year to sink a ball in a net, I think we can all agree the same that here. So there has to be a little bit of parity. So there's going to be some shifts we're going to see brought on again by the pandemic. I can tell you, I do all of my surgeries in ASC. Tomorrow I have a full day of surgery. I haven't set foot in a hospital in over 5 years to do a surgery. And I do shoulder replacements. I do, sometimes big microsurgery, and the patients go home. There's really no reason now. That's not the same for cardiothoracic surgery, where you open someone's chest and they're very unstable and they need to be in ICU, and that's understandable. And again, that's shifting partly because of the pandemic. And we're seeing much more almost retail medicine, where the access that you can have to somebody, whether it be even in your CVS pharmacy, you can at least see a well-trained nurse to at least get the ball rolling with your care. And the simpler things can be oftentimes diagnosed and treated. So I think we're going to see more of that. Even that medication is going to be dispensed more and more by the clinicians without you have to go and wait in one of these big mega pharmacies. There's just really is no reason for that. And of course, telemedicine. There's been an explosion. I've spoken to colleagues who say, many of the older patients have embraced this. I mean, imagine not having to leave your house and to be able to get an initial diagnosis, perhaps, or follow-up to discuss the blood tests that were ordered. You don't need to really drive somewhere, park, go in to see the clinician. We are, in the 21st century, and this little tool right here has a lot of power. So this concept of single specialty med centers, I brought up over 10 years ago. You can see a little less gray hair there. This was a decade ago I've been talking about this, and now it's being accepted. So the urgent care centers that have sprouted up around the country, the problem with them is that they often don't have the expertise. So you don't really want to go in there with an eye problem, because they're not going to know about it. And you don't want to go in there with an orthopedic problem, because many times, unless something is very obvious, they're going to call it a sprain or a strain, and that's not really an accurate diagnosis in most cases. So the idea is to have more specialty walk-in centers, and the quality is certainly going to be in many cases superior to traditional emergency room, where you shouldn't be going with an ankle sprain or back pain. Now, you break your femur, you break your hip, that's understandable. You're certainly going to need to go to a traditional hospital. And this is an interesting graph that talks about this concept of ortho now, that sits in this corner where we have high access. In other words, very easy to get into, no appointments. You can even use our app to notify us you're on your way. But we also have the expertise, because we're not seeing sore throats there or COVID symptoms. We're seeing simply musculoskeletal problems. And we've done a cost analysis of this. This is just looking at injured workers. You can see for one diagnosis, a difference in cost for whether you go to say an occupational health center where you're seeing kind of a general physician versus an orthopedic walk-in center. And again, it is also for the older patients, because not everything that we see is an emergency or urgent. Sometimes patients come in just with knee pain. Well, they didn't know they have maybe the beginning of mild osteoarthritis, and we can treat that early arthritis without you necessarily even going to the super specialist. we can get the ball rolling. And then if we need to refer to the knee surgeon, for example, we can do that. So we're going to see more of this in different sectors of medicine. Okay, and even this website, Markets Insider, commented on things I've written about the idea of sort of specialty centers with easy access. Okay, and again, I mentioned the pandemic has accelerated this. Now why is this? Well, again, even our colleagues in major emergency rooms are not infallible because they're seeing patients with chest pain or pneumonia, a million things. They're not going to be experts on subtle ankle injuries, right? They're going to do the best they can. But the point is that we all run to the emergency room and have to understand that the diagnoses aren't always accurate. And it's understandable. I was an ER physician in New York to try to help pay bills while I was a resident. And if a patient came in with an eye problem, I can tell you I was completely lost. I was on the phone with the ophthalmologist in minutes because I just didn't have that expertise. Okay, so what Ortho Now is doing is eliminating that sort of ER middle person. You know, you have, as long as you're able to ambulate, you're able to go into an orthopedic walk-in center. And we're seeing more and more of these type of facilities around the country. Okay, even joint reconstructions now, as the population ages, it's amazing to look at the numbers of knee replacements, hip replacements. As I'm getting older, I'm having friends now. I just spoke with a friend of mine who's a dentist in Minneapolis. I'm actually hoping to ski with him in a few weeks, but he needs his hip replaced. So he's going to ski and suck it up, but he hopes to ski after he has his hip replacement. And he was talking to me about this, and I said, you know, one of the things you want to try to do is have it done in an outpatient center. The infection rate is lower. Certainly the cost for your insurance company and even your out of pocket is going to be lower. And frankly, I find it to actually be safer in many cases because these are centers that do, you know, one replacement after another. And we're going to see more and more of that. And again, the pandemic has accelerated this. So this is a video. I won't, for interest of time, but you can find this on my website. If you just, and I'll give that website later, drbadia.com. You can see this testimonial from a patient who flew from Suriname. It's a small, obscure country in the northern part of South America. And there was nobody really in his country who does this kind of surgery. He came to Miami and he was back, flew back home within a week after a shoulder replacement. So in terms of streamlining care, again, we're using technology. Ortho Now, we have an app. So anybody listening could go to their app store and just type in Ortho Now. So at Ortho Now, if you obviously have to be in the geographic area if you're going to use this feature, you can actually say that you're on your way now. And then Uber we've collaborated with both Uber and now Lyft, can pick you up and take you to the nearest Ortho Now. I mean, that is a big, big advantage. And we also have telemedicine, which you see in this corner. This is not even the latest version of our app. I think now this button is over here. So even if you're in, say, Oregon or Texas, you can actually do a remote telemedicine consultation with an orthopedic clinician through our app around the country. Obviously, if you needed something, whether it be an X-ray or a procedure, then we'd be able to help find a clinician in your area. Okay, and so here I'm showing this telemedicine session I'm doing with a patient. You can see they're on that monitor, but this is not new. If you look at the date here, this was an interview I did in Spanish in Mexico City, and I was speaking about telemedicine back here. There's the arrow, 3 years ago, 4 years ago. So this is not a new concept. It's just that the pandemic has accelerated the engagement with this. So I think that we're going to see a lot of changes in orthopedic care, very positive changes that will impact our aging population. I mentioned moving to the outpatient realm as much as possible, less infection risk, less cost, more efficiency, seeing the right clinician at the right time. We often minimize that, but we've gotten to the point where many times the insurance forces us to see the overworked, busy primary care doctor when they really shouldn't be seeing you for shoulder pain, because you really want to see somebody who understands the shoulder, not just an orthopedist. You want to see an orthopedist who does a lot of shoulder. It just makes sense time-wise and cost-wise. I mentioned already osteoporosis and osteoarthritis. There's going to be increasing use of orthobiologics. Please be careful what you read about stem cells. There's a lot of false promises out there. Certainly there is some amazing things in terms of injections that we can do, but so far we don't have the holy grail yet, but I think we're going to see changes. And there are things I'm doing now with injections that have really helped patient get some relief and buy a lot of time potentially before they need a joint replacement. I mentioned digital health, so not only being able to contact your clinician, but also being able to monitor your health. So many times the cardiologists and other diabetes specialists are able to monitor their patients with digital health. And that is probably one of the largest areas of investment right now in Wall Street is digital health. And I mentioned before about insurance. I think we have to change how insurance companies really cover us and deal with us. And maybe in the future, it's going to also be catastrophic, meaning you may not use your insurance when you're going to go see either your primary care doctor or your daughter brings your grandchild to the pediatrician. They may just pay because and use insurance mainly for more expensive things, or when you do have to end up in the hospital. Okay, so a lot of these concepts are brought forth in my book, and I actually love speaking to older patients because they still read. I can't get my kids to read my own book, but I think that the older patients, and I'm including myself there at this point, are love to read, and I love hearing the feedback. So this book is on Amazon. You can also get it through Barnes and Noble online, or you can go directly to a website that I set up that has little videos that actually introduce each and every chapter. drbadiabook.com. I had some very interesting background reading for this. So I do suggest some of these books. One of my favorite ones is the last one here, The Case for Free Market Healthcare, where we talk about the fact that we can't necessarily depend on the government. We have to let market forces, because when there's competition, costs go down and efficiency goes up. And some of these other books talk about the cost of healthcare, and really need to do something about it. So obviously the last one is mine, and you can get that at that website.
Very good, Dr. Badia. I got a couple questions.
Yeah.
First one, what role will our primary care physicians and geriatricians have in the future for bone and joint issues?
Yeah, I think that clinicians of that type are the ones who follow you, right? So when you see somebody like me, it's episodic. You might see me because your shoulder hurts, or you might see me because you fell because of the osteoporosis and broke your wrist, and I'm going to put a little plate, screws, and get you back going. But you're not going to see somebody like me a year later. These physicians are going to be the ones who follow you. They're going to be monitoring the type of medications you're taking for both osteoarthritis and osteoporosis, and helping with the prevention. And we all know that preventive healthcare is oftentimes the best. And that's not necessarily what our role is as subspecialists, but rather the geriatricians and our trusted primary care doctors.
Yeah. So somebody asked Dr. Badia, says, how is it possible that a busy surgeon took the time to write a book about healthcare problems in our country?
One word: lockdown. Or is that two words?
Yes.
During the lockdown, I was lecturing in Australia. It's an interesting story. I had started the book a year ago, mostly compiling the opinions of the other people who are in the book. But I had to write a lot of my own part. And for that reason, you asked the question. Yes, it is hard as a busy physician and also an entrepreneur to do that. But I felt it was important to tell the story. And then what happened is when I got back from Australia, my office was basically closed for a period of time. Even my kids didn't want to see me because they were worried I was exposed. Tom Hanks got diagnosed with COVID right around the time I was in Sydney. And so I came back, I was on lockdown, and I said, now's the time to finish a book. So I sat down in front of the monitor just like this, and for 10, 12 hours a day, I pumped out the book. It took me about 10 to 12 weeks to write the whole thing. And it was released in early June. So that, we either binged on Netflix or you wrote a book, or you did a little bit of both in my case.
Very good. And once again, Dr. Badia, your contact information, you said the email and the website. You've got a couple different websites here. Could you mind spelling those out for those that are listening on our podcast?
Sure. I think the best website for them to it's easy to remember is drbadia.com. That's DR, B as in boy, ADIA. So drbadia.com. At drbadia.com, You can get to the Ortho Now website
Yep.
there. You can certainly get to the website for the book, Healthcare from the Trenches .com, and they can actually ask a question directly. I field questions from patients all the time. So far I haven't been overwhelmed, but the idea would be that you would send me a very specific question, and I do my best to answer. And many times I end up referring to somebody in your area who I know is good in that area. So certainly if it's an upper limb problem, that's my specialty. So I know colleagues who do what I do in most cities, not only in the US, but around the world.
Very good. Very good. As far as knowledgeable aging, you can find our webinars on our website. You can also go to our website is www.knowledgeableaging.com. You can also go to our YouTube page, type in knowledgeable aging, encourage you to subscribe. We update that 4 to 5 times per week. If podcasts are your thing, you can go to Spotify, Apple Tunes, etc. Till next time, I'm your host, Jason Kotar, and this is Knowledgeable Aging.